Hi, my name is Andrew Phillips. I'm the founder and editor-in-chief of EM Coach, the only artificial intelligence-driven medical education platform out there. And I'm pleased to share with you this month's question to EP Monthly. I love this question. If you haven't already read the question, please do so, because we're going to go over the answer and talk about what it is. But I love this question because it requires a combination of basic fundamental anatomy understanding, in addition to simply knowing some of the clinical signs and symptoms of things that are out there. And in this case, it's Horner's syndrome. So with Horner's syndrome, classically what you're going to see is a combination of a ptosis and anhidrosis, and also a meiosis, little I, right? So the pupil is getting smaller. There are a few other features sometimes you can have with Horner's syndrome. You can have a little bit of the enophthalmos, where the eye is appearing to be set back just a little bit. Let's talk realistically here for a second. You're probably not going to notice the anhidrosis, but you should be able to pick up clinically the ptosis and the meiosis. And those two things can then kind of pick your brain, whether it's for a question that you're working on for the boards, or you're seeing a patient in clinical practice. Those two things together should automatically raise flags for what's going on here with Horner's syndrome. And the idea with Horner's syndrome is that it's a problem with the sympathetic chain, the ascending sympathetic chain along in the neck. And this is where the fun part of the anatomy comes in. So the sympathetic chain is ascending inside that carotid sheath. And with this MVC, whether it be because of the MVC or, for example, with direct trauma, you can get a carotid dissection. Horner's syndrome is not always associated with a carotid dissection, nor does a carotid dissection always cause Horner's syndrome. But it puts those two things together, that this question tests those two knowledge bases. And the idea here that I want to use the video to explain is that when you have the dissection inside that carotid sheath, the pressure starts to build up inside the sheath, and then it presses against that ascending sympathetic chain, which is then causing the ptosis and the meiosis and the anhidrosis and such. So you have to remember that sympathetic chain is ascending, and it's inside that carotid sheath. It's all packed in together. So putting together that dissection with the Horner's syndrome is important, raising both those kind of red flags in your mind. Just to round it out, Horner's syndrome can be caused by anything impacting that sympathetic chain. Other examples include, especially in children, like a lymphoma can cause that, anything pushing against it, a direct trauma. And so keep in mind that it's not just a carotid dissection, but remember the Horner's syndrome classically is the anhidrosis, the ptosis, and the meiosis, M-I-O-S-I-S. This is Andrew Phillips from EM Coach. Thanks for watching.